And at the end of 2017, Louisiana ranked 4th in the highest rates of infection of HIV. In Louisiana, currently we have about 22,000 people who are living with HIV, and of those, about 11,000 who actually have an AIDS diagnosis. Black people have definitely bear the burden of this epidemic. Behind the numbers, the high rates of infection, there's a story to each of that. There's a reason why our rates are so high in Louisiana, because here we are looking at these structural barriers or these social determinants that impact these numbers, and these numbers are our clients. When we have clients who are living in rural areas, transportation, Louisiana, again, a southern state, which is a poor state, poverty, unemployment, illiteracy, which impact a client from accessing care, being retained in care, or not reaching viral suppression. So we have to look at the cause behind the cause. For instance, if a physician say, okay, why did this person drop out of care? Or why are they always late for an appointment? Or why didn't they come to the appointment? We're trying to get away from actually blaming the client. So we need to start blaming these systems that are in place and these social determinants that are in place. We need to make sure that those basic needs are met so that their HIV can become a priority, because now our clients, they face so many challenges, so they can't make their health a priority. We want to make sure that they're healthy, that they get the treatment that they need, that they're undetectable so that they cannot transmit the virus. That's why our Data to Care project is important. Data to Care simply is using data to identify clients who need to get back into care or who need to access care. We use surveillance data to identify the clients who are on a list, clients who have not accessed care, clients who need re-engagement in the care. And in Louisiana, we take it another step further. We have clients who are in care but still have not reached viral suppression. The Linkage to Care coordinators, they are our staff at the health department. They bring the humanity to the Data to Care piece. Because of course you're looking at a lot of data, you're looking at numbers, but the Linkage to Care coordinators, they are the ones that lend a voice to those people who are not in care. Once a Linkage to Care coordinator identifies a client on this not in care list, they make every attempt possible to contact that client. They meet the client where they are. They can actually come to our office, or we can meet them in their home. If they don't want to meet in their home, we meet somewhere in the community, coffee shops. Some Linkage to Care coordinators have even met clients in their cars or anywhere that's comfortable for the client. Then that's when they meet with them finally, tell them about the program, talk to them about getting back into care or even accessing care. Also talk with the client and see what are some of your goals that you want to achieve. What are some of the challenges? Why did you drop out of care? So after they've had that initial conversation with them, then they set up appointments, doctor's appointments, lab appointments with them. They attend those appointments with them to make sure that they can navigate through those daunting systems. Basically, they are with them every step along the way to their journey to becoming virally suppressed. And then once a client becomes virally suppressed, they help them with strategies to making sure that they are retaining care and maintain viral suppression. Can we solve poverty? No. But we certainly can help a client, along the way. When we look at our data about the health disparity among Black people, even with our health outcomes, that we are finding that even gay and bisexual men are reaching viral suppression. So once we are able to engage them into our program, get them connected to care, that they are reaching viral suppression, which is definitely a great outcome. And so that just shows the importance of this project, that the Data Care project, it does work. So I think that if we continue to have the resources to keep the humanity side in place, I think that will, aside from the money, continue to sustain this program.